Dear friends, thank you very much for tuning to our channel today. Today I want to talk a few minutes about antidepressants in the management of pain. Unfortunately, pain is a universal problem and we have to try different medications. Today I would like to talk about Tricyclic Antidepressants, TCAs, and serotonin norepinephrine reuptake inhibitors. They have these analgesic qualities and we can use these medications sometimes in addition to anti-inflammatories. So I would like to talk a few minutes about these things today. The use of antidepressants in the management of pain, especially neuropathic pain. And as I said last time, the mechanism is still unknown. Antidepressants may also be effective for their painful conditions like Duloxetine. I have one patient who has been using Duloxetine for fibromyalgia, and she said that it is working well for her. It is giving her relief. Analgesic antidepressants, they provide pain relief. And it is something different from their antidepressant effect. And analgesic effects, they can happen even at lower doses than for antidepressant effects. So the analgesic efficacy of antidepressants in neuropathic pain, it has been established in non-depressed patients. And many times it can affect both. It can give analgesia and also it can help with depression. The tricyclic antidepressants, I will suggest TCAs for the sake of brevity. So TCAs, and they are not indicated for pain management, but they still can be used in chronic pain states. If the patient has depression, they are more useful because you can treat both depression and pain using these medications. They are divided into tertiary amines and their demethylated secondary amine derivatives. So although a tetracyclic medications like Amitriptyline is often used, let us think about tricyclic antidepressants like Amitriptyline. So Amitriptyline, I saw so many patients with Amitriptyline, and it helps a lot of people with chronic pain. And Duloxetine, Imipramine, Nortriptyline, Disipramine, they can also be used. TCAs are believed to have independent analgesic effects, and they have an ability to relieve depressive symptoms associated with chronic pain. And as I said, the mechanism of analgesic action is uncertain. It has been theorized that analgesic properties are associated with their serotonin and norepinephrine reuptake inhibition. So these neurotransmitters, they increase in the synapse and they increase that pain control. But the problem is there are so many SSRIs that are completely useless in pain control. For example, you take Prozac, fluoxetine. So it's a very good SSRI. It helps a lot in the treatment of depression, but it doesn't have analgesic properties. So that theory is also does not completely make sense. So it remains to be seen why these tricyclic antidepressants have analgesic properties. We still don't know the exact mechanism, but we certainly know that they help. That is the reason we are using it. So you start with low dose and you go to the high dose. Some patients respond only at the high dose. So TCAs, not triptyline, you start with like 10 milligrams per day and go up. after a week like 20, and after that like 75 milligrams per day. But it takes like 6 to 8 weeks. So you always tell patients it takes time. Unfortunately, we have people, this McDonald's mentality. I call this McDonald's mentality. Like you drive through and you want a sandwich, you want a milkshake, you want a drink. You pick it up in 2 minutes and you are gone. So people come to doctors with the same mentality. I have pain, I need relief in 2 minutes. No wonder we have an opioid epidemic right now, because we write some narcotics and take this and you get relief. But folks, that's not how it works. You need time. Tricyclic antidepressants, they take weeks and weeks. So you need to tell people that wait, like 3-4 weeks, let it act. So they have reasonable analgesic properties, but unfortunately they also have adverse effects. And sometimes the good news is these adverse effects, they go away with time. Adverse effects are mainly anticholinergic effects and antihistaminic effects. Duloxetine has the most potent antihistaminic effects. Then alpha-1 adrenergic receptor blockade, cardiac effects, they increase intraventricular conduction, they prolong the QT interval, they prolong conduction through AV node. So among TCAs, amitriptyline has the most potent anticholinergic effect and desipramine has the least. So that is the least sedating. So the anticholinergic, every time we say anticholinergic, always think about elderly people, because they make their life miserable. Like you get this dry mouth and you get that orthostatic hypotension, dizziness, constipation, like you have to go to restroom and you force yourself. It's very miserable thing to give an elderly patient with the serious anticholinergic side effects. So always think about them. But sometimes they cause sedation. So that's a good thing. For example, if somebody has insomnia, if you give them this medication, its side effect is actually helping them. So the clinicians must explain to the patient why TCAs are used, how to administer them, what benefits and side effects might be expected. So if they have sedation, this is a side effect. So if the patient says, "Doctor, I have this insomnia, I can't sleep," well, here you go. This medication, its side effect is sedation. So it helps with your insomnia. And if you have this morning hangover, take it a little bit early so that it won't fall back into the morning. So then constipation, think about stool softeners. And patients should understand that although analgesia may occur in days, it frequently takes weeks. As I said, it takes sometimes like 4 or 5 weeks. So it is important that you tell people about these unpleasant side effects like dry mouth, mental clouding, and those things. Doctors should be, they should inform people about the dosage and the intolerable side effects. And when one antidepressant doesn't work, then go for the next one. If low dose doesn't help, go to the next high dose. So you have to go through these different options to get that correct amount. And once the people stay there, they will like it. And also remember cardiac side effects. Like if people have like intraventricular conduction problems, always do an EKG. So first do an EKG and then think about starting people on tricyclic antidepressants. And also gastrointestinal problems. And desipramine and nortriptyline can be used safely in older patients. So you start with the low dose and then you go to the high dose. So antidepressants can be definitely used, and they are actually helping people. I have a few patients who are taking like Amitriptyline and Duloxetine, and those medications are helping them. So if people use these medications, they definitely can expect some pain control. I hope these points would help you. Thank you so much.